Hello friends, I am dr.Ande.LakshmiNarasimhaswamy. Today another interesting remedy I will today explain, that is antimonium tart. The antimonium tart contains, since its treasury edition 2009 is 154 results, 154 rubrics. The main important is mind section is mind anxiety increases with the nausea. Mind carried desire to be carried, sitting up. Mind clinging to attendant. The antidote patient is one important is clinging attendant. Mind coma with a dark face. Mind delusions ought to sleep, he sleep. Mind delusions sleepings, he were in a stupid sleep. Mind delusions water, he wades in water. Mind despair in intermittent waking. Mind fear approaching of others approaching of during menstrual colic. Mind fear menses during menstrual colic. These two rubrics is present in female symptoms. Mind indifference, pulse retarded, mind irritability, children shriek when touched. Mind irritability during the disease, in acute disease, thought. Mind mourning in babies twice each time. Mind shrieking during sleep, eyes with trembling and fixed eyes. Mind stupefaction during cough, thought. Mind unconsciousness with asphyxia. Mind whimpering sickness before attacks. Before attacks of sickness, whimpering, weeping. Now the head symptoms of antimonium tart patient. Head constriction after washing, aggravation. Head cough during aggravation. External head cough during aggravation. This is the antimonium tart patient. Head heaviness, menstrual colic, menses. Head heaviness, menses, colic, menstrual colic. Head pain extending to nose, drawing pain. Head pain, forehead, afternoon 14 to 3 hours. Pain, forehead, afternoon 14 to 3 hours, tearing pain. The pain of the antimonium tart patient is tearing pain. Head pain, forehead, after dinner, stitching pain. Head pain, occiput, after dinner, stitching pain. Two present. Occiput. This is forehead, this is occiput. Antimonium tart. Head trembling during coughing. Head trembling after exertion, aggravation. Now the eye symptoms of an antimonium tart patient. Amblyopia, emotions, aggravation. In antimonium tart, eyes outer canthi granular. The eyes present in granular canthi in antimonium tart patient. Eyes inflammation accompanied by pneumonia. Eyes staring during sleep. Staring sleep during sleep is present in antimonium patient only. Eyes vision dim when is comes after emotions. The dim vision is present in antimonium patient is after emotions dim vision will comes. These all rubrics are authentic information is present in synthesis reaction. Nose discoloration, black wings. Now the nose symptoms. Nose tension root above the root as from a band. The face symptoms of antimonium patient. Face discoloration about lips cyanotic. Cyanotic lips about the blue color is present that is present in heart conditions or respiratory conditions in the patient. Smutty, face smutty. Mouth symptoms of the antimonium patient in single rubrics. Palate, disagreeable sensation. Palate. Mouth open, remains open after yawning. The antimonium patient single symptom is mouth opening after remaining yawning after also open. The throat symptoms of antimonium. Throat mucus. During fever, copious mucus present. Antimonium. Throat pain, pharynx, sneezing aggravation. Stomach appetite increased in open air emulsion. Stomach symptoms of the antimonium single rubrics. Stomach flatulence of stomach, sensation of flatulence of stomach in epigastrium. Stomach nausea accompanied by skin coldness. Stomach nausea accompanied by skin moist. Stomach nausea accompanied by skin relaxed. Stomach nausea passing flatus aggravation. Stomach retching accompanied by weakness. Stomach retching accompanied by forehead perspiration on forehead. Stomach thirst periodical day, alternate day. Stomach ulcers are bleeding type. Stomach vomiting moving from right side. Stomach vomiting type of vomiting bile in drunkards. Stomach vomiting type of vomiting mucus in drunkards. These two symptoms is present in antimonium patients. Drinking habit present that way drunkards. Abdomen bending forward aggravation sitting when sitting. Abdomen compliance of abdomen intestines accompanied by sleepiness. Abdomen stone in abdomen, sensation of a stone in abdomen, full of stones, seems sitting bent forward aggravation. Abdomen stone in abdomen, sensation of a stone in abdomen, a full stones, seems sitting long time aggravation for a long time aggravation. The rectum symptoms. The rectum symptoms of the antimonium present. Cholera accompanied by tongue white mucus. Rectum diarrhea accompanied by rashes. The rashes is present the diarrhea is present, accompanied by rashes also will comes accompanied. Rectum tension perineum before urination aggravation. Rectum worms complaints of worms cystostome antintort. Now the kidney symptoms of the antintort patient. Single rubrics. Kidney pain, motion of arms of aggravation. Kidneys pain, motion of arms, aggravation, stitching pain. The male genitalia of the antintort. Male genitalia and sex eruptions, pustules are red. Male genitalia pain in testes after suppressed gonorrhea. These two symptoms are present in antintort. Single rubrics. Now the larynx symptoms of the antintort. Larynx and trachea, croup accompanied by head bent back. Larynx and trachea, croup accompanied by neck stretched out. Antintort. Now the respiratory symptoms of the antintort. These respiratory symptoms are very important in antintort. Every person, every doctor will be gives in respiratory systems is more important in antintort patients. Respiration accelerated, disturbed when disturbed. Respiration asphyxia, amniotic fluid because of aspiration of pneumonia to prevent pneumonia. Respiration, complaints of respiration alternating with cough. When the antintort patient cough alternating respiratory systems is 2 or alternating is present. Respiration impeded obstructed. Morning in bed aggravation. Respiration impeded or obstructed. Evening in bed aggravation. These two symptoms impeded. 4 symptoms are present. Respiration impeded obstruction, expectoration from obstructed expectoration from. Respiration impeded obstructed by heat, sensation of heat, heart reason of heart. The respiration intermittent unequal lying down aggravation. Respiration cold wet weather aggravation. Cold wet weather aggravation is the antintort only present. Cough symptoms of antintort. Cough accompanied by comatose sleep. Cough accompanied by sleepiness. Peculiar symptoms of antintort is the sleepiness is present and cough is present. Both are unequal. Cough, distracting cough is only present in antintort. Cough distracting day and night. Day and night cough, distracting cough is present in only antintort. Cough, hissing hoarseness raises hand to larynx which is sensitive to touch with sensitive to touch. Cough, jumping up in children, clinging to those around, calling for help in a hoarse voice and bending backward and grasping at the larynx. Antintort is the present in that the children is jumping is present, jumping up is present, clinging those around the persons, then calling for help in hoarse voice, bending backwards and grasping at larynx is only present in antintort. Grasping sensation is present. Cough, short, talking aggravation, antidote. Cough eruptions, pimples red, lichen simplex like lichen simplex. Cough expulsive power, wanting lungs, lungs wanting lungs. Cough formication, mame, left. Cough heart complaints of the heart in children. Cyst kada. Cyst heart symptoms of the children in children. Cyst hepatization of the lungs after pneumonia. Cyst inflammation bronchial tubes accompanied by little fever. Cyst inflammation bronchial tubes accompanied by perspiration, cold perspiration. Cyst inflammation bronchial tubes accompanied by comatose sleep. Cyst inflammation of lungs accompanied by face cyanotic. Cyst inflammation of lungs accompanied face pale face. Pale face. Cyst inflammation of lungs accompanied by lungs, lids covered with mucus, sides of lids covered with mucus. Cyst mame complaints of mame behind left. Chest pain, heart sprained as if sprained. Chest pain, chest palpitation of the heart before stool is present in only the anthem thought. Chest revolving sensation as if the heart were. Chest strain, heart strain had been strained as if heart had been strained. Chest weakness, weakness lungs accompanied by cough. Chest eruptions. These are the chest symptoms. Now the back symptoms of the anthem thought. Back eruptions, pustules, cowpox like in cervical region. Back eruptions, scabs, bloody, cervical region. Back heaviness, weight, rising aggravation. Back heaviness, weight, coccyx sensation as if a heavy weight were tugged at anthem thought. Back pain, lumbar region, rising bed from aggravation. From rising bed, aggravation. Back pain, lumbar region, from rising bed before present. Back pain, spine rubbing against each other as if vertebrae are rubbing against each other. Now the extremity symptoms of antimonium tart patient. Extremities, coldness, toes, touch, cold to touch. Extremities, eruptions, legs like varicella. Extremities, eruptions, lower limbs like varicella. Extremities, flexed upper limbs, sleeping during sleeping aggravation. Extremities, numbness, forenoon 10 hours, 10 o'clock. Is only present in antimonium tart. Extremities pain, rising aggravation. Extremities pain, rising aggravation is a sore pain. Extremities pain, knees, evening bed in bed. Stitching pain in evening bed aggravation. Extremities pain, knees, tendons, evening. Extremities pain, knees, tendons, stitching pain, even evening stitching pain. Extremities, perspiration, lower limbs during menstrual colic is present in the only antidote. Extremity stiffness, legs, tender Achilles, walking aggravation. Now, the sleep symptoms of the antimonium tart patient. Sleepiness alternating with vertigo. Vertigo is the reeling sensation that is present with sleepiness alternating with vertigo and sleepiness. Sleepiness, riding in open air riding, aggravation. Sleep yawning alternating with cough. Sleep yawning chill before mouth remains open for a long time. Sleep yawning coughing, especially in children. Sleep yawning stretching with forenoon. Sleep dreams of antimonium tart. Dreams rousing the patient forenoon sitting while sitting. Chill symptoms of the antimonium tart. Chill night rising aggravation. Chill anticipating every other day several hours tertian. Chill creeping before menses. Chill internal extending to outward is the only present in the antimonium tart. Now the fever symptoms of the antimonium tart. Fever alternating with chills, motion aggravation. Fever, dry heat, night, driving out of bed. Perspiration symptom, cold, terminal patients in cold terminal patients. Skin symptoms of the antimonium tart patients. Skin eruptions, pokes, large pokes. Skin eruptions, pustules or bleeding. Skin eruptions, pustules, thin pustules breaking and discharging ichorious pus corroding the skin and spreading about. Skin eruptions, pustules, vesicles mixed with vesicles. Pustules and vesicles are mixing is present in only the antimonium tart patient. Now the general symptoms of the antimonium tart. The convulsions in children. Attention directed to them when attention directed them when antimonium tart. General convulsions when smallpox fails to break out. General's euthanasia to induce euthanasia, respiratory complaints. General's faintness, closing the eyes aggravation. General's faintness between spells, cough. General's heat, lack of heat, warmth aggravation and terminal patients. General's knocking sensation. General's medicine, allopathic, schistosomiasis, injections for schistosomiasis, antimonium tart. General's pulse hard in old people is present in the only antimonium tart patient. General's pulse weak accompanied by uneasiness in stomach is present only in the antimonium tart patients. General's sauna amelioration. General's stretching out with yawning forenoon. General's weakness accompanied by weak pulse. General's weakness accompanied by respiration compliance. These all are the single rubrics of the antimonium tart. Now these are the symptoms present whenever the patient will comes. These symptoms will be useful to in daily practice. I will explain also to next remedy is apis. Okay, thank you for watching.